How's it going? It's Dr. E with Modern Manual Therapy, and today we're going to go over 5 ways to increase your mobility of the hip without actually stretching. Many times with a lack of hip mobility, according to the clinical practice patterns I talk about in Modern Manual Therapy Premium and Modern Manual Therapy seminars, there's a lack of ability to accept load on the hip, which often results in adduction and that typical valgus drop, where it seems like a lack of stability. But if there's a lack of hip flexion and internal rotation on that side, they can't accept load. So this example would be actually improving hip mobility on the left, which is side gliding to the left, lumbar side gliding to the left. You can stack the shoulders over the hips, have a fist or web space on the hip, and it's a passive bend to the left, and to further go into side bending, make sure you side bend the head to the left, because the intention is to kind of fire a promote a left side gliding pattern. It's side gliding over side bending, because in side bending the iliac crest actually ends up hitting the 12th rib. So there's a bony approximation there that you get with side bending that you don't get with side gliding. A common mistake is that they end up flexing, so they're not stacked. Just make sure they're stacked, and maybe even anterior pelvic tilt. They won't be able to go as far, and you're going to feel a stretch. I tell the patients you're going to feel a stretch on this side. The goal is not to stretch this side, the goal is to accept load of the lumbar spine on this side, and you'll see that you can actually improve hip mobility using this repeatedly without actually stretching the hip. Another way to improve hip mobility without stretching is to do agonist reversals, a type of PNF stretch, or a type of PNF exercise. I do this manually on patients, and I can teach them easily how to do it themselves. So the instructions are, when you contact here, and you only have one hand contact at a time, when you contact on the anterior thigh, they're going to resist into flexion, and then contact on the posterior thigh, you're going to resist into extension. So again, this is typically to improve a lot of that pinching or anterior impingement feeling with what seems like an FAI. So wherever that pinching point is, and I'm kind of getting one right here, you resist into that, and they push into the resistance. So I'm going to push in, and push out, push in, into flexion, and into extension, flexion, extension. And the amount of resistance is only enough to get past that perception of pinch. And again, if someone actually has a real bony pathology, it's not going to change significantly, and you have to respect that. But many times what seems even like bone is really just tone. So the question would be tone or bone. And if it improves rapidly, it was just a tone problem or a motor control problem. And after several reps, they should actually have increased mobility passively, and also increased ability to accept load and weight bearing. If you or the patient has a general feeling of hip flexor tightness, a great way to improve that without actually stretching your hip flexors or doing your typical static quad stretch, standing quad stretch, is to actually activate the hip extensors in a single leg bridge. So if I were to feel that in a half kneel, and I feel a significant stretch right here, what we want to do, you can do this banded eventually as a progression, but I'm just going to activate the posterior chain and maybe hold that for 30 to 60 seconds or so, or as well as they can tolerate. If they can't do a single leg bridge, they can always regress to this with a focus on driving this heel down in. This one is really just to help them keep stable. Okay. So again, I'm going to hold this for a little bit, and we can time lapse this. And afterward, when you go to retest, now I can actually get into some hip extension with some posterior tilt without actually feeling a significant stretch there. So it's an easy thing to work on, and it's also an easy way to show the patient how to eventually get to that area loaded. And after you do any kind of reset, whether it's a pain-free psoas release, side gliding and standing, this is just a different way to keep improving the hip mobility at home, again, and avoiding that perception of stretch. Many times when a patient gets better, the mobility improves, or your mobility improves, quickly and it goes away, and it improves quickly and it goes away. It's just a motor control problem, or it's you're changing with whatever reset or stretch you did, or technique that was done on you, you're changing the perception of a feeling of tightness. Because I like how Hardgrove puts it, you just have a bad feeling in your hamstrings. They're not really tight, they're not short. So a great way to modulate that is to use something like an edge mobility band, and again, it works best if you wrap tech side out. So just wrap wherever, and again, wrap as lightly as possible. Wrap wherever you feel the greatest perception of tightness. And again, since the goal of this video is to show how to increase hip mobility without stretching, I'm not going to do any kind of functional movement pattern with this, but a great way to change that is then just to use this and just kind of twist the tissues into internal and external rotation. And one way might be tighter than the other. And I feel this is a little bit tighter into more of an internal rotation pattern, because that tends to be the direction that this hip is limited. I might do this for a minute or so. Again, if none of these things change after 30 seconds to a minute of trying these, then you have to try something else. Any one of the other techniques in this video series. And if it was more external, you can try that. I can also put myself into more of an internally rotated position and progress like that. Maybe 30 seconds in neutral, 30 seconds in a more internally rotated position. Then they can recheck with something like a quadruped rock back in neutral, and then a quadruped rock back in IR, and that should be improved. One of the last ways I like to show how to improve hip mobility without actually stretching is more of a loaded pattern. It's either a SUPERCLAM or a side plank, and I think Dean Somerset was one of the first people to post online, so I got to give credit to him doing side planks to improve hip IR. I like to regress it and change it up in a couple of different ways. So again, if someone has that lack of ability to accept load in their hip, the hip ends up going into an abducted position and the knee ends up going into valgus. So you can see why this area of the trunk may not necessarily be firing appropriately when they're trying to accept load. So I like the SUPERCLAM, and I think it's easy. A lot of people are limited in the side plank because their shoulder ends up bothering them. So the SUPERCLAM is a clam modification where instead of just going up with the unloaded leg, the leg that is actually on the table is also supposed to open up, so it's supposed to open up bilaterally like that. And you've got to make sure they stay stacked. They can go up to 90 degrees for a bit more resistance, and 45 if they can't handle this. So I'm going to push down, and they can hold it or they can just do reps depending on what their shoulder tolerance. So if I'm holding that, I can really feel this in my glute med. A typical side plank, which is a little bit different, and I'm going to regress this a little bit and just go on knees. I tell people that I want to cue them that the tension should come from here in a side plank versus a SUPERCLAM, it's going to come from the glutes. So those are two ways that I think, again, you load those up either isometrically, or you just do reps as tolerated, or as I like to progress, you want to do up to a total of 3 minutes, maybe 6 sets of 30 seconds, then progressing to 3 sets of a minute, and then 2 sets of a minute and a half. And I think that eventually ends up firing this side so that you're more stable in single leg stance.